Health insurance open enrollment is coming up for millions of Americans.
Yeah, so here today to provide us with some tips on how to pick a health plan is Tim Archer, the Chief Executive Officer of United Healthcare of New England. Tim, thanks so much for being here. So let's start with the basics. What is that huge umbrella of open enrollment and how can people be prepared?
Yeah, thanks for having me on today. Open enrollment is the time of year where most Americans have the opportunity to select or switch their health plan benefits for the upcoming year.
Yeah, and this is a specific time, right? So when can people purchase health insurance?
It is. It really depends on the type of insurance you need and where you get it today. So for the 170 to 180 million Americans with employer-provided coverage, most employers set aside a few weeks between September and December to allow employees to make their elections. For the 64 million members eligible for Medicaid, Medicare, that runs between October 15th to December 7th. And then enrollment in state individual exchanges usually runs between November and December for most states.
All right, so what are some tips that can help people pick the right plan or maybe even save some money on their health care?
Yeah, great question. First, really just the basics. Start with understanding all your options. Compare and contrast the plans that are being offered. Understand the costs. And one good way to start there is, refresh your memory on the insurance lingo. So copays, deductibles, out of pocket. What does all that mean, and how does that influence the overall cost for you? For the Medicare folks, they need to decide between, do we want to go the original Medicare route with the government or maybe a Medicare Advantage product through, a national carrier or a local carrier like United. After that, really anticipate your expenses for the upcoming year. Are you going to have a surgery, maybe have a baby, things like that could really influence which plan might work best for you. After that, think about your prescription drug benefits. Do you have a prescription that you fill every month or every other month? Could you do that at home through mailing? Is your pharmacy in network? Are there low-cost generics available? Those are all key decisions to consider to find the right cost for your drugs. On the innovation side, think about plans that offer virtual capability, whether your primary care options, specialists, urgent care. Those are these are new in the last couple of years, or more popular in the last couple of years. And I really recommend that, you find plans that offer that, because it really helps with convenience and cost, especially on the mental health side, right? We've seen that recently the last couple of years because of the pandemic. So it's a real great option to do behavioral health virtually as well. So make sure your plan offers that as well.
Also, you could get some specialty benefits or perks, like maybe even a free gym membership. Tell us about that.
Yeah, for sure. We talked about those core medical benefits, but don't forget about the ones that we use every day as well, like, vision, hearing, dental. Those are all key attributes of your overall health and well-being. So don't forget to research that as well. On the perk side or the wellness side, definitely look to see what the plans offer, right? Some offer financial incentives to stay active or exercise regularly, avoid bad, unhealthy habits, things like that. So look for plans that offer that. Some offer, gym reimbursements or access to online fitness communities. So those are all the latest, things you can do to keep yourself healthy outside of, going to the doctor.
All right, really quickly, Tim, where can people go for information on their health insurance?
Yeah, we encourage you to go to uhcopenenrollment.com. We've got a bunch of easy to use videos and articles to really help you navigate the insurance landscape and really navigate this open enrollment season.
Awesome. Tim Archer, thank you so much for all very valuable information.
Thanks for being